The broad concepts of recommendations or treatment for arthritis, certainly the vast majority of all these recommendations are suggested and are carried through with before one starts to contemplate surgical intervention. Modifying activity certainly needs to be considered as part of treatment. Sometimes folks forget about the fact that they can maybe back off a little bit from the activities that they enjoy doing. There's a little bit of a fine line between maintaining your activity, maintaining your fitness, yet not over using the joint such that it flares up and becomes swollen. Physical therapy is also often recommended and suggested, not only for exercises, but there are some modalities that the therapist can do to try to help some of the symptoms, including electrical stimulation, ultrasound. But it's always good to keep the muscles around a joint strong, even if you end up having a joint replacement. That just means that stronger muscles around a joint will improve your rehab and recovery. If it's pertinent to the individual, weight loss is certainly something that can and should be considered. There have been quite a few patients who have lost weight and haven't gotten rid of their arthritis. You can't really get rid of arthritis once there's wear and tear, but have certainly improved their symptoms with weight loss. Walking aids such as canes are certainly an option to use, depending on the severity of the symptoms. Medications, non-steroidal anti-inflammatory medications, over-the-counter, such as ibuprofen or Aleve, certainly are oftentimes effective. And then we have prescription anti-inflammatory medications, such as Celebrex, Naproxen, Voltaren, and others. Analgesics I put in there. Some people cannot take anti-inflammatories. They're either on a blood thinner or they have GI issues that could create GI upset, and they have to avoid anti-inflammatories. Although Tylenol is not an anti-inflammatory, it can still help with the symptoms of arthritis. Most folks have heard of the natural health supplement glucosamine chondroitin sulfate. It is something that we typically recommend. You don't really know if it's going to help you as an individual patient until you try it, and there's relatively little downside in trying it. We typically have a handout, and I believe it's in the packet that was passed around on glucosamine and some basic information about glucosamine. Injections are a part of treatment, particularly for the knee. It's more difficult to inject the hip, again, because it's deeper and shrouded by a thick layer of muscles. The knee joint is much more commonly amenable to a cortisone injection. If someone comes in with a bad flare-up of knee arthritis, they stepped off the curb the wrong way or maybe twisted their knee, flared up their arthritis, and we can offer a cortisone injection. The other type of injections, and again I believe that there's an information handout in the pamphlet, are hyaluronic acid injections. There are several brand names out on the market, Supartz, Hyligan, Orthovisc, Euflexa. Basically, Hyligan injections are, in a simplistic way, thought of as a lube job for the knee. There are either 3 or 5 injections each a week apart. They're thought of in the same way as taking anti-inflammatory medications or doing a cortisone injection. They try to help decrease the local symptoms of arthritis. Some folks have the impression that it restores new cartilage. That's not the case. It's basically to treat the symptoms. And then we can resort to surgery. Either total hip or total knee replacement if the arthritis is advanced and severe and the person's gotten to the point where they feel that the symptoms are interfering with lifestyle, normal daily activities to the severity that it's time to do the joint replacement. Occasionally with knee arthritis, we can consider an arthroscopy. Arthroscopy is not a treatment for arthritis in and of itself. The act, some folks come in and say, well, can't you just wash my knee out? If the only problem was the arthritis, a washout of an arthritic knee, particularly if it's more advanced, may benefit the patient for a week or 2 weeks or a month, but you're basically back to square one. The reason we usually do a knee arthroscopy is because the patient has more mild arthritis and they've developed a meniscus tear, a cartilage tear in the knee, and the arthroscopy is mainly to treat the meniscus tear, not really the arthritis.